Palliative care has been part of our medical landscape for several decades, and still very few of us have full access to it. When contemplating end-of-life choices, or when faced with a serious diagnosis where recovery is uncertain, should I trust palliative care, or should I consider other options? With the help of two recognized experts in the field, Dr. Golda Tradounsky and Dr. Vinay, this short video aims at answering your questions and those of your loved ones about this specialized medical care, whose name palliative was coined in Montreal in 1973 by Dr. Mount. So who could benefit from palliative care? Is it only for those at end of life, or those dying from cancer, as many people seem to think?
I would hope that palliative care is actually care for people who have all kinds of illnesses that are potentially progressive, advanced, and who will bring about some symptoms, but not just for people with cancer. And why start only when people are dying if people are actually suffering way earlier on in their illness trajectory? So no, palliative approach is a care to help people live better with a serious illness right from the beginnings. And this can be offered by treating physicians, and it can be offered by experts in palliative care and expert palliative care teams.
It's aimed at treating not only the physical, but the emotional and psychological suffering of the patient and his or her family throughout the trajectory of the critical illness. Palliative care can begin as soon as the diagnosis of a life-limiting illness is made. The patient can receive palliative care at home while traveling to the medical clinic for appropriate follow-up. In time, a whole system can be put in place to ensure that the patient is well surrounded 24 hours a day with the possibility of specialized medical care.
Home is also the elderly place. It's also the hospice. Another alternative is the Maison de Soins Palliatifs, House of Palliative Care. Those special places will provide for you, free of cost, a room with all what is required in that room, a very calm, very adequate place for a proper end of life. An equivalent of that is the hospital unit of palliative care. It's the same thing. The last place is the hospital. And often people go to the hospital because the home has become impossible. So they call for the ambulance and bring the people to the emergency room of the hospital. This is a busy place where all sorts of things occur. Suddenly the last place to obtain the peace and the proper environment for the end of life.
Palliative care is actually a care whose main purpose is about improving quality of life. And I would like to emphasize the word life. We're here to help people live better. People who have a diagnosis of a severe illness that may progress over time, who might develop symptoms because of that illness, and of some symptoms of whatever nature. It could be physical, but it could also be psychological, social, spiritual. And the palliative approach is there to help with all these symptoms, even from the moment the disease is diagnosed. It's there to accompany the patient, and it's also there to accompany the family.
The idea that palliative care means death is just around the corner is very much alive in people's minds. But palliative care can last for 2 years, sometimes more. Palliative care has to do with the objective of the medical actions. Let us remember that palliative care never seeks death, even at the end of life.
In the population, many people have the impression that when you start to give morphine to a patient, it's the end. It's gonna last a couple of days and then he's gonna die. And they attribute this to the fact that they receive morphine. Morphine is bad for your heart. If you receive morphine, the heart will suffer and will stop. And if the heart stops, you're dead. So, morphine is something that you should avoid. In fact, when you become very sick, when you have a lot of pain, where you can't breathe normally, you need to be helped. Morphine and other medication of the same sort are perfectly appropriate and will not reduce the span of life of anybody if it's normally prescribed. It is safe, it is useful, and we should keep it for people who needs it.
Is pain necessarily part of the end of life? In my opinion, no. For sure, every day that we're alive, we've got a little bit of discomfort and pain. That's normal. But just because we have a serious progressive illness, that doesn't mean that that pain needs to increase. Most physicians, whether they be specialists or family physicians, should be able to take care of patients' pain. And if they're having some difficulty, they should refer to a palliative care team. Palliative care teams have an interdisciplinary group of experts working together to try and make that pain as tolerable as possible, and they usually succeed very well.
Since it came into effect in Quebec in 2015, the Act respecting end-of-life care has provided a framework for both palliative care and euthanasia, now known throughout Canada as medical aid in dying. This dual inclusion has led to much ambiguity and confusion over the years, raising the question whether or not medical aid in dying is actually part of palliative care.
The answer is no. Palliative care is there to help you to have the most fruitful and natural life at the end of your life, without the anxiety, the pain, and all the suffering that goes with it sometimes, until it is the end. Even if you become comatose, you will have what is required to be comfortable. This is very different from medical aid in dying. Here, you decide not to go further. There is no future after this moment. You have been amputated of a part of your life. What would have occurred in this part? We don't know. Maybe something precious. That's why this is two different ball games.
These fundamental differences explain why the vast majority of health professionals working in palliative care refuse to administer medical aid in dying, and why many hospices still choose not to offer it under their roof. The Living with Dignity Citizens Network supports their choice and encourages you to investigate the matter further in future videos. Each of the questions addressed in this video is developed in greater detail in longer videos with Dr. Golda Tradounsky and Dr. Vinay. You can find the links to them in the description of this video or on vivreddignité.org, where you are invited to read the manifesto for a natural and dignified end of life and for quality healthcare in Quebec, which you are invited to sign. Thank you for your attention. Please take the moment to share this video on your social networks so we can raise awareness about palliative care. Thank you to all those who support and advance palliative care.